Hey, welcome to Your Personal Health. I'm Jeff Harrison along with Dr. Krista Burris. Dr. Burris, welcome.
Hi, how are you doing, Jeff?
I'm doing well. Hey, I noticed that your sidekick is not there today. You guys are busy. You said something in the earlier show that we're starting to see an uptick on the COVID activity. Give us a little update on that real quick.
Well, the numbers are still going up. We're definitely nowhere as bad as some of the areas of the United States that are seeing large surges, but we have noticed an increase in our local cases and in demand for testing and concerns that workplaces are having, etc.
So
So
this
we're
is
seeing a
keeping
bit.
so this is keeping you and Dr. Kim busy.
Yes, yeah, definitely.
All right, so get out there. I know that I just saw today or heard today that now that third shot is ready to go out. Are we waiting for that, or is that something we can get now? Is there a time date on that?
For most people, we're not going to see that third shot be coming out until the end of September, probably the last week of September. The one exception is for our immunocompromised people. Definitely talk to your doctor because you should qualify to get your third shot now.
Is there a sweet spot as far as, hey, if I've had shot one, shot two before I get the third shot?
Yes, it looks like you want to wait about 8 months at least after
Mhm.
that second shot.
Okay.
So you can kind of count back. It's 8 months after the second shot, not the first shot.
Great. So keep that in mind, gang. If you're out there and you're thinking, "Hey, I just got my second shot. Now I got to go to a third shot." Not necessarily. You know, you're probably in really good shape. And Dr. Burr, stop me if I'm wrong. That you can now put some time between you and that third shot because that vaccine is really strong, or let's say it's right in your body, and that third shot is really. Are we calling it a booster shot?
Yes, for us immunonormal people, I guess I would say, it is considered a booster shot, and that's why you don't need it right away. Um, we wait sort of until the effects of it are starting to wear off, and so that's later on, about 8, 9 months later.
Gotcha. Okay. Hey, if you're just joining us, this is called Your Personal Health. We're here every weekday on Wednesday at about 3:25 in the afternoon, 3:30, and we get the chance to have Dr. Burris and Dr. Kim when they're both available here on the show. And we get to talk about things that are affecting your health. And if you've missed in the last few weeks, we've talked about sugar and we've talked about other things that are affecting your health. This show is about, hey, how do we raise our level of consciousness and really live our best lives when it comes to health? And today we're going to talk about that word that sometimes, we hear this, if it comes out of our doctor's mouth, we're a little concerned. Dr. Burst, it's cholesterol. Can you tell us about cholesterol today?
Sure, absolutely. Cholesterol's something that we've been talking about for decades and usually in a negative context. So we think about cholesterol and we think about, oh, that's bad.
Mm.
Um, Cholesterol is a normal part of our bloodstream. So we all have cholesterol and it's actually used by the body in different functions. It's basically almost like some building blocks for making fatty acids. So, fatty acids are really important in our cell membranes. There's a lot of things that they do in the brain. Um, so, we need some, and it's important. There's a reason that it's there. But unfortunately, what happens when we get too much of certain types of cholesterol, it can start to sort of clog up our arteries.
Mm.
And almost, if you think about pouring straight up like bacon grease down your sink, how it might actually stop up your drain. It's
Mm.
sort of the same concept, this sort of cholesterol buildup on the sides of the blood vessels can actually clog our blood vessels. And then sometimes it'll pull off the edge of that blood vessel, kind of like ripping a
Mm.
scab off a clot. In fact,
You're really
exactly.
graphic today, Dr. Burris. This is
You
good.
know, I can be as bad as you want.
I mean, I can visually feel that. I mean, I can see it and I can almost feel it. So keep going. I'm sorry. So you're ripping the
Oh,
Band-Aid off the sore and here comes the
yeah.
scab.
So you're ripping it off and it pulls off the lining of the blood vessel. And when that happens, our bodies are designed to clot because it thinks you've been cut. So if you expose the inside of a blood vessel, the body will clot it to prevent bleeding. Unfortunately, you're not bleeding. And when you put a clot in a blood vessel, say in the heart, you have a heart attack. When you put a clot in a blood vessel in the brain, you have a stroke. So heart attacks and strokes are often caused by these, what we call cholesterol plaques rupturing. And rupturing means it's pulling off the lining of that blood vessel and the body responds by clotting suddenly. What they've looked at over the years is, well, what happens if people have really high bad cholesterol? And what happens is they have more heart attacks and strokes. And what happens if we use medicine or lifestyle changes and lower their cholesterol is they have less heart attacks and strokes. So that's why we care about cholesterol. That's why we check for it. And that's why we spend time treating it. And honestly, it's one of the biggest things that we do in primary care is keep an eye on people's cholesterol because we don't have to treat that many people to actually prevent one of them from having a heart attack.
Wow.
In medicine, it's called the number needed to treat. And I think for cholesterol, especially if it's really high, that number is only in the realm of like 40 to 50 people. So in a practice, you're going to save a few of your patients a heart attack or a stroke if you pay attention to it.
Are there some early signs that people could be looking out for that would be saying, hey, if this is happening, it could be early warning signs that your cholesterol level, the bad cholesterol level is high and you should have it checked out pretty quickly?
There are some people whose cholesterol is so high they get actual cholesterol deposits under their skin, which look like almost like a white pearl under their skin. Pretty large, honestly, about the size of a pea.
Wow.
So something like that, usually people notice. Sometimes as a doctor, we'll actually notice cholesterol deposits on people's eardrums. There's all sorts of interesting ways. But for most of us, we're not going to notice that. Cholesterol is really silent. It doesn't cause you any problems until it causes that heart attack or stroke. So most of us don't know unless you get it checked. And that's why we recommend actually checking cholesterol at some point around age 30, just to kind of see where you are, to give you an idea whether it's something you need to be aware of. There are families who have a familial kind of high cholesterol, and in those families, we check starting around age 6 months. So that's unusual. For most of us, it's going to be, at some point when you get into early adulthood, go ahead and get your cholesterol checked. Just see where you are.
Are there, when we say checking, are there some numbers there? Because it seems like over the years that those have changed. Like used to be like, wow, if your number was 300 or higher, you were really in trouble. And then it was like 200. Where are we at now? And what should we be looking at when we have our cholesterol checked and that number comes back that we say, okay, it's got our attention. We probably need to change our diet, maybe have some medication. Where are those numbers at now?
Okay. So the numbers and the targets change depending on your risk factors. So your numbers or your targets are going to be lower if you've got other risk factors for heart attacks or strokes. So if you've already had a heart attack or if you have diabetes, your goal is going to be a little lower than the average person because we want to protect you a little better. But for the average person, your goal is you want your bad cholesterol, or LDL, or low
So
density lipoprotein.
LDL is the one that's the bad one. We want to watch that number closely. Okay.
Yeah. And that one, you really want it to be less than 130.
Wow.
If you're in a high risk category, you want it to be less than 100. And for this number, if you've got heart disease, there really isn't a number that's too low. So
Okay.
if you come in with an LDL of 60, everyone's just going to smile. No one's going to say, "Ooh, that's a little low," you know?
Yeah.
So your bad cholesterol, or LDL, in general, we want it to be less than 130. You also have good cholesterol. And this sort of is like a counter to your LDL. And this is your HDL, or high density lipoprotein. And the HDL sort of acts like a vacuum cleaner, and it goes around kind of cleaning up your arteries. So this little guy is something we want as much of as possible. So in this case, we want your HDL to be above a certain number, and it needs to be above 45. And one of the things that's difficult about HDL is we really don't have any medicine that increases it. It's mostly increased by exercise and a little bit increased by following a really good diet. So HDL is one of those things that you can usually get it up a bit, but it's kind of genetically predetermined. So it's a little bit of a pain. I've actually seen people in their 30s come in with heart attacks, and their only risk factor was a low HDL.
Wow.
So HDL is important. You don't really hear about it much, and it's because honestly the drug companies aren't talking about it because they don't have any medicines for it. But it's something we look at, and if we notice that somebody's HDL is low, we're going to advise lifestyle change rather than necessarily medication, because the meds don't do too much to help it.
Well, on that same vein, if somebody comes in, they're tested, and their number is above 130 for the LDL, is that one of those things where has that been driven potentially, genetically as well as their lifestyle, and you look at both of those things, and maybe then when you discover, hey, this is something that runs in your family, or it doesn't run in the family, do you look more at their nutrition?
There's a portion of it that's going to be genetically predetermined, and then there's a portion that's flexible and can be altered with their lifestyle, specifically diet and exercise. So we usually, if somebody is very high risk and has a very high cholesterol, we may start everything at the same time. We may start a medicine as well as lifestyle changes. If someone's fairly low risk, but their cholesterol is fairly high, we're going to hit that lifestyle change real hard and keep a close eye on it and see if that's enough, or if we're going to need to add a little bit of medication. And then there are those people who are kind of low risk and come in and their cholesterol is just a bit up. We're going to start with lifestyle modification. We're going to recheck that maybe 6-12 months down the road, see where they are, keep encouraging them. If your cholesterol is 140, if your LDL is 140, unless you're a very high risk person, usually they don't get started on medication immediately. But if we're following them and it's just continuing to creep up and go the wrong direction, it may be necessary.
Now, you said, at what point should someone start having their cholesterol checked? Would you say, you said in their 30s?
Yes. Most organizations, there's different recommendations from different organizations on this. But I think most of us feel that unless you have a family history of a lot of early heart disease, like if there are people in your family have had heart attacks in their 70s and 80s, that's considered sort of normal.
Mm.
But if you've got people in your family who've had heart attacks in their teenage years or in their 20s, that's a different scenario.
Mm.
But for an average patient, sometime in their late 20s or early 30s is a good time to get a first cholesterol. And then if it's normal, you probably don't need one more than every 5 years or so.
Okay.
Yeah. And if it's elevated, then you want to have a talk with your doctor about what you want to do to address it and then how soon to recheck.
Now, is that something, the cholesterol check, is that something that Coachella Valley Direct Primary Care, do you offer that to your
Oh,
patients?
yeah, absolutely.
Okay.
And we can draw blood here in the office or have people go to the lab of their choice if they want to do a lab real close to their home, because it's a fasting value and early in the morning. Either way.
So that's something that you, if somebody comes into your office, they're a patient of yours or a member of the clinic, do you do all the testing on site, or now do you send it off to the lab afterwards?
No, if we draw the patient's blood, then we send it to the lab like normal. It's mostly a convenience issue
Mm.
about where the person wants to get their blood drawn, but it's all processed the same in the traditional labs.
Gotcha. You said something that I thought was very interesting. You said, you as a primary care physician, that if you're seeing about, I think you said in that 40 to 45 patients, that this tearing of the cholesterol off the lining of the artery, or it was the artery,
Yeah,
that
usually.
that could be a life-saving situation. Is that about 1 out of every 40, 45 people? Is that did I
Um,
understand that correctly?
yes, 1 out of every 40 or 45 high risk people.
Gotcha.
So it's not, every healthy 20-year-old that walks in the door, you might have to treat, 2,000 of them.
Okay.
But when we're looking at people who've got other risk factors, maybe high blood pressure, diabetes, and they've been smoking, um, with those people, their risk for having a heart attack in the next 10 years is really pretty high.
Mm-hmm.
So by addressing those patients carefully and making sure that we're controlling their cholesterol, we can potentially change the rest of their life.
Yeah, the reason I bring that up is I know in some of the episodes early on we talked about there's a real concern about a shortage of primary care physicians, not only across the country but here in the Coachella Valley. And I wonder how many people have put their I'm going to say the routine of being checked up every year or every 3 years, every 5 years, whatever the routine is, that they really have put that on hold. And now it's 10 years, or maybe it's been 15 years since they've had that they have become a high risk when they didn't have to be.
Actually, I think that's something that is happening, and our shortage of primary care doctors is making it worse. And
Mm.
then the pandemic is certainly adding to that problem. Um, I sat and thought about it, and I'm like, wow, this is the third school year that my kids are being affected by the pandemic. And I'm
Wow.
like, wow, that's a lot more than I thought. and and then I started doing the math, and I'm like, yeah, this has been going on for a while. And I think for a lot of people, these type of routine health things are really easy to put off because nothing's hurting. It's not something that if you don't do it this week, something bad will happen and you totally can put it off for a week. But
Mm.
if that week becomes 5 years, you may be in a much higher risk scenario and have more cholesterol deposits if you've been going along all that time with undiagnosed high blood pressure and undiagnosed high cholesterol.
I think about these situations where there are blood drives. Are there situations? Can you, or is it just me being unrealistic of saying, hey, we could have a cholesterol drive, and people come in and have their blood tested just like they would of giving blood? Because quite frankly, isn't that a life saving measure that you could start and help
Yeah.
so many people? Say, hey, every X day of a month, we just do a cholesterol drive, and you come in and have the test done, and really kind of get that into the forefront of people's minds that this is something they need to check on because of what you were saying. There's really no early warning signs. It's a stroke or a heart attack.
Yeah, in fact, we used to see this being done fairly routinely at health fairs, at employers. And there still is some employer-based screening going on that I'm aware of out there. But we're no longer having these big health fairs that we used to have where people would come in and they'd get, checked for diabetes or screened for cholesterol, get their blood pressure done. And, if you go to the pharmacy, you can do your blood pressure, but they don't have a little cholesterol machine. So I think it is definitely one of those things that's flying under the radar right now, that's sort of being missed. I mean, we've given some attention to the fact that we're way behind on things like mammograms and colonoscopies, and cholesterol is just kind of hanging out there under the radar right now. But it's definitely one of those preventative screening tests that saves tens of thousands of lives in the United States every year. It's just people don't think about it a lot.
Yeah. Hey, I put your information along the bottom because, again, there are a lot of folks that come in and out of the Valley that are not permanent residents, but maybe they're hearing this today and think, wow, it has been a long time since I've had my cholesterol checked, and I need to do that. I know your facility, you have memberships. Tell us a little bit about that.
Yes, Coachella Valley Direct Primary Care has a model where our patients join the practice on a membership basis, and then they're considered one of our patients. And when they do that, we do their primary care for them, their routine screening tests like this, and we can help arrange it in ways that are convenient for our patients, as well as utilize the insurance they may have when they need to get tests like this done.
Yeah, it reminds me of right now, my wife is in North Dakota with her mother who's moving. She's 82 years old. She's moving to the Phoenix metro area. And I got to thinking, wow, wouldn't it be nice, because I know there's a shortage of primary care physicians. Wouldn't it be nice if there's a place out there like you offer here in the Coachella Valley that she could just plug into and not have this gap in her healthcare? And I just think that would be such a nice thing. So I put your information along the bottom that if you are in now the Valley, or you are facing a situation where you're saying, I really don't have a doctor, or for my kids or for myself, just call the number on the screen, which is 760-642-5549. And it is a membership-based program. And I'm going to put on the screen here real quick. It's just for if you're 45 and younger. It's just $99 a month, and then after 46, it's only $145 a month. And now, Dr. Burris, if you're a family, do you have family programs as well that are different for the pricing?
Yes, if we have more than one person in a family who wants to be a member, we do give discounts for them.
So take action today, because let's face it, there's a saying that says, a healthy man has 1,000 dreams. Someone who is sick only has one, and that's they wish they were healthier. Don't fall into that latter category. Get out there and take action now. Do it. It's almost like that. I remember that commercial says, you can pay me now or you can pay me later. But if you wait and pay later, it's always a higher price. Don't let that be your health. Get a hold of Dr. Burris. Get a hold of Dr. Kim at Coachella Valley Direct Primary Care Physicians. And if you've seen this, and you're saying, wow, I know people, share the link. Invite them to watch the program. We talked today about cholesterol and its silent way of impacting our health, and take action today. I really appreciate you sharing and getting us to understand, hey, the LDL is our bad and what it does and what it looks like. I can still see that bacon grease going down the sink, and then the Hoover side, if you will, the HDL of cleaning up, and we wish that were a little higher. So I really appreciate all the time you gave us today, and go back and listen to this, because I think Dr. Burris gave us some wealth of information and awareness to keep us healthier. Dr. Burris, thank you so much. Any last words before we sign off for today?
No, stay safe out there, stay cool, hydrate, wear your mask.
I like that. All right, you guys be safe out there. We'll see you next week on Your Personal Health. I'm Jeff Harrison, along with Dr. Krista Burris. Thank you, guys. Take care.